So, I'll tell you a little bit about myself. I'm Bruce Eimer. I have a PhD in educational psychology and statistics, which I forgot long ago. Statistics. I went back to school to get my PsyD, which is clinical psychology doctorate, in '83, and traveled through pretty fast and got out in '86 at Hahnemann University, or Hahnemann Medical College, which is no longer Hahnemann. It's been bought out and sold several times since. Now it's Drexel. But I finished in '86, got licensed as a psychologist in PA in '86. Been practicing psychology in Pennsylvania since '86. One of my mentors was one of the pioneers in the field of hypnoanalysis, Dr. David Cheek, who, again, has since passed on. He passed at the age of 86 in 1996, and he and I worked together from '92 until he no longer could talk on the telephone, which was somewhere in the area of around February of 1996, which is when I had my back surgery. But he prepared me doing idiomotor finger signaling and hypnoanalysis on the telephone. And we traded letters, because there was no email back then, relative to his encouragement of me to prepare my first book. So he gave me a lot of positive feedback and critical feedback that led to the writing and publication of Pain Management Psychotherapy, which came out, published by John Wiley & Sons in 1998. Here we are today, and my use of hypnosis continues. That in the last 4 years, I have been working as the director of behavioral health at a rather busy hospital-based pain clinic, where we see people who are significant medical and psychological and psychiatric wrecks with severe chronic pain syndromes and often severe psychiatric disturbance, many of whom, at least 50% or more, are opiate seeking. And when they had their major problem at the hospital before they hired me, where they just didn't know what to do with all of these folks, they put out an ad for a pain psychologist with experience in addictions. And I was hired on the spot when I went for the interview. I don't know if it was because of my charm. I doubt it. It was more because I had the legitimate experience, and they needed someone like me to basically clean things up. And I did. And I haven't stopped learning. I've been there 4 years, and I still am surprised at least 4 or 5 times a week with people that I see with tricks and deceptions that will always make me humble. And so you never stop learning. Don't use hypnosis to mask pain of unknown origin. That's the whole key, okay? You don't want to do that. You might have a brain tumor on your hands if somebody complains of headaches and they haven't been to a neurologist and had an MRI. You don't want to do that. So acute pain, be careful. Then there's subacute pain, or is it? Yeah, it's subacute pain, which basically is, so like they used to say that pain that lasted up to 3 months was acute, pain that lasted from 3 to 6 months was subacute, after 6 months it's chronic. You know, you don't have to put labels like, you know, it's 61 days, it's subacute. You don't do that, you know. Basically, if it doesn't respond to treatment, it doesn't respond in a way that's expected for the type of pain that you think it's caused by this or that, it's like, what's going on here? And it just continues unabated. You know, then it's subacute, and eventually when all other things are exhausted, it's kind of chronic, and that's the kind of pain that so many doctors, unfortunately, use that very, very negative expression. You got to learn to live with this. We're going to move on to learning objective 2, which is some theories about how chronic pain develops. And if you look in your workbook, it's chapter 3. I'd like to get some participant feedback, and we'll keep the tape on. I'll repeat if necessary, but everybody has a theory about a lot of the things that happen in the world. Everybody has a theory. And like, what's your understanding of how chronic pain develops, or what types of things might make a person vulnerable to developing a chronic pain syndrome?
One of my beliefs would be, excuse me, would be the way that they were treated as they came up. If they were to injure themselves and then all of a sudden, let's say an adult or a parent was right there on top of them to console them, to tell them that everything will be all right and whatnot. Now they're not necessarily, the way that they're perceiving pain is that it's something that they have to watch out for. That all of a sudden, oh, no, got to watch out. You can't experience pain. That it's not something that they can just handle and then move forward in their life.
So overprotective nature of parenting, maybe.
Yes, possibly, yeah.
Okay.
When I taught pain management in the clinics, they got used to it, became their friend. And they didn't want to let it go.
Mm-hmm. Why didn't they want to let it go?
They got attention.
Mm-hmm. Okay.
And they got used to the drugs.
Okay. So there was like secondary benefits.
Yes.
And maybe, what's your first name again? Ron? Maybe as Ron suggested, they also had a history of getting a lot of attention when they hurt. Okay, thank you, Barbara. Thank you.
You're welcome.
I'm going to present to you some ideas based on research and based on my own clinical experience, okay? I've been working at the pain center, seeing probably around 40 patients a week. And I see some for ongoing treatment and some for just evaluation. So over 4 years of working there, I've probably seen at least 1,000 different pain patients, at least. And over the 25 years that I've been doing work with pain on and off, I've seen a lot. But here at the pain center, which is the place the people who are in pain, whose lives are painful, most of them are disabled or they're suffering from some sort of physical impairment, even if they aren't declared disabled and they are working, God bless, they're working and they're impaired somehow and they have pain, okay? And I'd say at the pain center, I see the majority of the people I see are low back, lumbar pain with leg pain associated with it, neck pain, and a lot of abdominal pain, people that have had multiple surgeries. For the people that have these really entrenched severe chronic pain syndromes that are disabling, that what they all seem to have in common, that the literature suggests is associated with the development of vulnerability to developing chronic pain. It's one insult after another, physically as well as psychologically, is a history of early childhood abuse, emotional, physical, and sexual. And that goes for both males and females. And so under emotional abuse, we can be talking about neglect. We can be talking about overprotectiveness in terms of parenting. We could be talking about overly critical parents or darned inappropriately punitive parents. There's a little experience I'm going to have you take right now, which is you're going to take a test, which is called ACE or ACEs. And that stands for Adverse Childhood Experiences Scale, ACEs. And I'm just going to have you look at it in a moment. Somebody could tell me what page it's on. You could find it. And I'm going to have you fill it out. You don't need to share these results with anybody. What page is it on? What page?
39.
Okay, so on 39 of your workbook is the ACEs scale. Let's get a better one now. Take a nice deep breath in. Hold it for a moment this time. Feel it pressing against your chest. And now just let it all the way out, nice and slowly, breathing out all the way down to your stomach. Breathing out stress and tension. And now just breathe normally.
Well, just what I would be imagining coming out of my knee, or again with a problem somebody else would have. I would just feel some negative kind of, any kind of pain. It could be, you know, whatever the heat from it or any kind of negative kind of thing.
Whenever you need to, wherever you are, whatever you're doing, when you're awake, any time that you feel any degree of discomfort that you'd like to lessen, that you'd like to relieve, realistically speaking, you can do it because you're building a memory, you're fixing in your unconscious mind right now a memory of transferring comfort into that knee or any other place in your body that needs it. This is very important. The laws of hypnosis are in your book, and they affect how to form, how do you create good suggestions. So I'm going to just give you a list. I'm going to explain it. Okay. Number one, keep it simple, simply.
Where you can go in the process, the different routes, because you can come to a fork in the road and there can be all different ways that you can go, and none of them are necessarily right or wrong, but it was interesting for me to see how you chose to go, because that, again, you're different than other people that I've observed or worked with, or how I maybe would choose to go. So it's interesting to see how somebody who's very experienced and an expert in the field works with this.
Mm-hmm. Wow, that was pretty well stated. I couldn't have said it better. Thanks. In the second edition of Hypnotize Yourself Out of Pain Now, published by Crown House Publishing, 2007. And it, you know, it's a bargain because it comes with a CD and everything. I think it's $24.95 or something like that.